front of the patient, anterior. We will complete the lung assessment, go on to the cardiac assessment, including the apical pulse. We will include, while we're to this point in the video, the GI section or abdominal portion of the assessment. Mr. Jones, I'm going to, at this point, continue to listen to your lung sounds. Clavicles are symmetric. We'll begin on your right. Heart sounds are present at this point in the assessment. No murmurs heard. Paying close attention to the mid-clavicular line. Noted that there is symmetry to the breast with no lumps. Mr. Jones, do you have any pain upon palpitation?
No.
Mr. Jones, although you're a male, you should monthly, generally at the same time, please take a moment just to feel your pectorals to make sure that you do not have any new lumps, that you do not have any new pain. Breast cancer is present in men, just as it is in women. While I'm palpating, do you have any pain under your underarms, coming down
No.
and around? Very good. Pinch the nipple. There's no discharge, no pain. My apologies, Mr. Jones. I like to do that fast while no one's expecting it. I'll come around at this point. Mid-clavicular line, fifth intercostal space. Present pulse. S1, S2 present. No S3, S4. For timing purposes, 15 seconds is all that I will take his heart rate for. I will multiply it by 4. I got a heart rate of 14 in 15 seconds. Multiplied by 4 gives me somewhere near his electronic pulse, which was 60. No adventitious lung sounds heard. To the side. Pulse remains the same. Radial apical pulse equal. Mr. Jones, could you please lie back so that I can now assess your abdominal section? Client with normal patterned hair. Thank you, Mr. Jones. Please relax. Symmetric on both sides. Lower even, upper even. No bruising or ecchymosis, no swelling. Now listen. We'll begin in the right lower quadrant. Bowel sounds present. Mr. Jones, when was the last time that you ate?
4 hours ago.
Mr. Jones, do you have any pain upon eating?
No.
Ever have any chest pain, Mr. Jones?
No.
Bowel sounds present. Do you currently have a cough?
No.
History of cough?
No.
When was your last flu shot?
8 months ago.
Good. Continue. Abdominal area with hollow sounds. We're assessed at a 6. This may hurt. If it does, please let me know, as that is a response that is abnormal.
Okay.
last bowel movement?
Yesterday night.
Bladder present upon palpitation, soft. When was the last time you urinated?
3 or 4 hours ago?
When I press your bladder, do you feel like you have to go to the bathroom?
No.
Any pain, sir?
None.
At night, do you use the bathroom more than 3 times a night?
No.
Do you have any urgency prior to using the bathroom?
No.
Increased frequency?
No.
Pain?
None.
Blood in your urine?
Never.
The last time you went to the bathroom, was your urine yellow, clear, bright amber, or pale?
Yellow.
Yellow it is. We'll take yellow. Client found with abdominal assessment to have no inguinal lymphadenopathy at this time. He will be referred to his GI specialist for his annual prostate exam and to be assessed for any hernias, both abdominal and inguinal. I will at this time begin to do the lower assessment of the patient. Mr. Jones, are you comfortable the way that you are, or do you prefer to lie down?
I'm comfortable.
I'll begin by assessing the patient's skin. Mr. Jones' skin is clean, dry, and intact. The hair on his legs are not patchy. They have symmetry to both sides. Popliteal present. Pulses remain present to the lower extremity. Client's skin is warm, although he has been undressed. Cat refill, less than 3 seconds to lower extremities. No edema palpated. Mr. Jones, do you ever have any trouble stumbling or walking?
None.
Do you have any pain in your lower extremities? Could you please flex your ankles? Thank you. Bilateral ankles with no crepitus. Please lift your knee. And the other. Bilateral knees with no crepitus at this time. I will now do his deep tendon reflexes. I will check his knee jerk reflex first. Positive bilateral. I will check his radial reflex at this time. Okay. Please relax for me, Mr. Jones. Very good. Bicep reflex at this time. Positive twitch to the muscle. Very good, Mr. Jones. I recognize it is difficult to visualize. However, Mr. Jones has a positive tricep reflexes. All deep tendon reflexes present upon assessment. I will at this time move on to the musculoskeletal portion of the assessment and combine some more of the neuro portion as well. Mr. Jones, at this point, I'll need for you just to bend your arms in and out for me. Very good. Could you send your arms out to your side? Please close your eyes. Touch your nose with your right hand. Touch your nose with your left. And I thank you. Put your arms in the air. Thank you, Mr. Jones, and bring them back down to your side. Do you have any pain upon movement, sir? I'm going to control your arm for you at this point. Please just cooperate by bringing your arm in a windmill. Any pain?
No.
Very good. To the other side. Any pain?
No.
Client has full range of motion. Neurologically, could you please tell me your full name, sir?
Brian Keith Jones II.
Today's day or date?
The 8th
The 8th of.
July,
And I thank you.
2014.
Can you tell me what city you are in?
Ewing, New Jersey.
Yes, sir. Client is awake and oriented ×3 at this time. As previously assessed, client with cranial nerves 2 through 8 are intact. I will at this point assess for sensory. Did you feel that, sir?
Yes. 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 Yes.
Did you have any tingling or burning?
No.
Very good. Client is with all sensation. We also assessed that his finger to nose